Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. Today we are talking about euthanasia. We have Dr. Katie with us. She's here in Jacksonville, Florida. So thank you for being on the show, Katie.
You're welcome.
So tell everyone a little bit about what you do.
Okay. So I'm a veterinarian and I've been practicing for over 10 years, but I practice exclusively end-of-life care. And so what that means is my practice provides in-home euthanasia. About 95% of my patients are euthanasia only. And then there's about 5% that we do hospice or a little bit more prolonged care. And we can talk about that. I usually meet my families for the first and the last time. So my patients I don't have any history with typically. I was actually thinking about this when we were talking last, a few weeks ago. Mm-hmm. There's actually several families that I've helped because I've lived in Jacksonville for, almost 10 years. There's some families that I've helped, multiple times, mm-hmm. sometimes 5, 6, 7 times, because our journey together has been most of the, they have senior pets.
Right.
And so that's when I build rapport and relationship. And, those are really tough appointments for me because I get to know the family. Yeah. And I know my patients, but 95% of the time I would say I'm meeting families for the first and the last time. And it's exclusively end-of-life care.
Is there ever, or have you ever had someone come in and say, hey, can you come meet us, or can you come sit down with us and A, let us chat with you, or B, give us your opinion on the dog?
Yeah, all the time. I think sometimes families feel very comfortable beforehand if they just talk to me on the phone, and I'm super open to that. I am such a less is more kind of vet. I don't have a whole protocol where, you have to fill out forms and do all this. Like, you call my cell and I usually pick up.
Right.
And if I'm in with an appointment, my assistant picks up. Mm-hmm. And so I've always been very, I think, hands-on mm-hmm. when it comes to communicating with families. It's such a sensitive thing. Mm-hmm. It really is. And I just went through this with my own dog a few months ago. Mm-hmm. And it's just that very cruel reminder of how hard it is.
Yeah.
And so if families, if they ask my assistant, they're like, can we just talk to Dr. Katie? I'm like, absolutely.
Right.
So I'll do a quick call or, a long call, whatever they need.
Mm-hmm. What called you to do this work rather than going into general practice?
So I started in general practice. I never, even, 10 years ago, in-home euthanasia, vets have been going to homes for decades, but mm-hmm. it was usually large animal vets.
Right.
Equine, horses, cattle. Mm-hmm. But, even just 10 years ago, this was very, very new. Mm-hmm. It wasn't even a thing. It right. was just like, maybe your vet will come to the home. And so for me, I left vet school, I graduated, and I went into private practice. That's just what most of us do. And I loved private practice. I loved connecting with families. I loved spending time with families, but that was a luxury. I mean, mm-hmm. usually it's like boom, boom, boom,
right.
like room to room to room.
Right.
And when I had started doing euthanasias in the clinic, I just remember thinking, this is not a 15-minute appointment.
Yeah.
This requires time and tact and being quiet. And, when you're in a clinic, there's dogs barking, mm-hmm. there's kids crying, there's people bringing in their new puppies.
Right.
So it's like, it just was very clear to me very quickly, this is ideally not the place to say goodbye to your pet. Mm-hmm. And of course, it's not always the case. Like there's emergencies.
Right.
There's, in the middle of the night, there's times where I can't get there fast enough. So I always say, go to your regular vet. But for me, the first home visit I did, I remember thinking, and everybody thought I was crazy,
Yeah.
honestly. I remember thinking, this is what I was meant to do. It just was that overwhelming feeling of, I love talking to families. I love spending time. I love things to be as natural and organic as possible, on a blanket, not on a cold table. I don't travel with a bunch of technicians. It's just me. I'm very, very private. I'm very discreet. And so it was just like such a flip of like what I had been doing in the clinic versus what it could be like. And that's when I really started to think, okay, this is something that I can do. And it was very slow building. It wasn't like overnight where I'm like, okay, I'm just going to, do home visits all day long.
Right.
But my career sort of had a very fast trajectory that way. And end of life care in the home has all I've been doing for now over 10 years.
Yeah. I think there's absolutely a need. I remember, so I had to go through this in 2017.
Yeah.
And I could not drive to the vet. I couldn't think of like being in this foreign room that was just all white with that cold table. I just couldn't imagine doing that. It didn't feel right. It didn't feel like I was giving her the dignity or respect, because you wouldn't want that to happen to you. And so that's why I looked into in-home euthanasia. And people are like, vets don't do that. That's not an option. You can't do it. Or that's an option for the wealthy. It's super expensive. You'll never be able to afford it. And all of that was untrue. So I'm grateful that this exists. And I think a lot of people are. And I think a lot of people will be relieved to know that it is an option.
Yeah.
Obviously in Jacksonville and surrounding areas, but in other cities too. I think this is growing across the country.
Yeah, it is.
So, and this one's a tricky one. And there's no black or white, right or wrong. When do you think it's time to start having that conversation of euthanasia?
Yeah, you're right. It is such a gray area. And I get asked this daily.
Yeah.
Multiple times per day. Here's my most candid response. It's like, if you're starting to think it might be time, it probably is.
Yeah. And if that thought pops in your head and that's your intuition, it's like you might want to go with that.
Yeah. You might want to just kind of explore that with your veterinarian or, with somebody like me or just even friends, family, because I will tell you subjectively, it's very hard to look at your pet and say, okay, it's time. The whole, like, they'll give you the look thing.
No,
it's so hard because, oftentimes they don't give you the look or, I'm a vet. And even with my own pets, I'm like, I don't see what I would normally see as a practicing doctor. It's a hard, very, very large sliding scale gray area of like, when is it time? It could be because of somebody's financial budget, because of somebody's time budget, because of somebody's physical budget. And what I mean by that is like, there's a big difference between a 80-pound dog with arthritis that can't get up and a 10-pound dog, right? Or even a 30-pound dog. There's a big difference between, like, you have little dogs. If they need to wear a diaper or if they're incontinent, there's a big difference between a little Pomeranian's bowel movement on the ground versus a 100-pound German Shepherd.
Right.
So it's just, I think when we start to think, gosh, Fluffy's not doing great, that's probably the time to start exploring what brought you there.
Right. And we won't get into this today. This is for a whole other episode. But then you've got, part two. You've got the medical side of things, a medical euthanasia. And then you've got behavioral.
Yeah.
And I know that's such a touchy topic. I've actually been seeing it more on TikTok, which is interesting. And you wouldn't believe the comments people are getting. But again, touchy subject. We'll get to it another day because that's a whole topic.
Let's talk about, just so your listeners understand, what a behavioral euthanasia is.
Yeah, absolutely.
Behavioral euthanasia is considered a euthanasia performed on a patient that is not, if you will, physically ill, physiologically ill, kidney failure, bone cancer. It is more due to aggression or aggressive tendencies, a dog bite that is likely to happen or will happen or has happened. That's what we consider a behavioral euthanasia. They're very controversial. And again, like that could be part two, because most of my patients are physiologically ill. I mean, and they can be young and have cancer, and they can be at the end of life, you know, truly that cliche, like 16, 17-year-old end of life. So there are a lot of, I don't even want to know what social media says in those comments. People are so cruel and they just don't understand.
Right.
But behavioral euthanasias are very, very hard for everybody involved.
Yeah.
I mean, there's no doubt about it. All euthanasia is hard.
Right.
Yeah.
The behavioral ones, I think, because you're trying to justify it to yourself and to everyone around you.
Yeah.
So I've known two people that have done it, and it's last resort. You know, we tell every trainer, doctor, behavioralist, we've done 20 supplements. We've spent thousands and thousands of dollars, and this dog is miserable. This dog bites me and others. This dog attacks everything in the house, that kind of situation. So yeah, that's a part two. In your opinion, are there any very clear, yes, it is time, a sign, a symptom? Is there ever a time where something happens, you're like, it's time?
I think that depends on, so sometimes I walk into a home, it's very clear that it's time. My patient is laterally recumbent, laboring to breathe, you know, actively dying. It's time. They're there. Their body has done most of the work. I'm just going to shepherd them across a little medication and make them comfortable. I think I'm such a proponent of dignity and quality. And now this is where it gets so tough, because it's like a lot of people will say, okay, well, when my dog starts having, you know, bowel movements on themselves, it's time. And then it starts happening and you're like, oh, I can just kind of pick it up and clean it up and we'll be okay. When my dog starts, you know, urinating in the house, it's time. Well, we get there, we're just wiping it up and they can wear diapers. And it becomes this, again, that gray area.
Yeah.
But for me, definitively being time, I think when they're physiologically ill, they're nauseous to the point where they choose not to, cannot eat, cannot hold water down. I mean, those are just really critical states that the body is starting to suffer.
Right.
I think what I always tell families is we want, hopefully, to intervene while they're struggling, not necessarily actively suffering.
Yeah.
We can help them where it's not premature, but they're not actively suffering. Laboring to breathe, can't lay down because they're fluid-filled chest, fluid-filled abdomen, or can't get up because they're so arthritic or in so much pain. I mean, those are very, in my opinion, definitive times. But we don't have to wait until they can't get up or that they can't physically swallow or don't want to eat. Right. I hear that all the time, like, my dog's still eating. Well, we've heard our whole lives, call me when they're not eating. Call me when they're not wagging their tail. And honestly, most of my patients are eating and wagging their tail when we say goodbye. It's just a number of other issues that are affecting their quality.
Yeah. I think that's how we've been predispositioned as pet owners. You know, it's only time if ABC happened. Yeah. And it's just not true. It's kind of the same with people. Like if you think of like an elderly person, like they might still be eating, but they're suffering and they, you know, they're ready to pass. They'll tell you, I'm ready.
Yeah, they'll tell you.
I'm done with this body. I want to go.
Yeah.
So yeah, I think it's tough to have like a clear yes, but I think yours make perfect sense.
And I'm like such a big picture person too. Yeah. I mean, that's the privilege that I get to see in a family's home is like, number one, a lot of vets see patients after they've driven in the car, they've waited in a waiting room, and they're super anxious. Yeah. So they're standing there like, ooh, you know, and they're not showing you what I get to see in the home. They're, you know, they can't get up, or they're super lethargic, or they don't really want to even eat a treat. But when you get to the vet, there's a lot of adrenaline. Yeah. And it's like the car makes a noise and you take it to the mechanic and it doesn't make the noise. So it's like the same thing. I feel so privileged to sit with families in the privacy of their home. Again, I don't I don't appear to be a vet. I always tell everybody that I just kind of show up and I'm a friend or a family member visiting, you know. So I feel like my patients are a lot more relaxed around me, and I get to see things that a regular vet in a GP clinic doesn't usually get to see. And so I love being able to go to the home. I'm a big picture person,
right?
Because when I get to the home, I see, wow, okay, Mrs. Smith has a 3-month-old baby and no help, and 2 other puppies. And then it's just this whole big picture that starts to develop where, you know, you don't usually get that when you work at the clinic and you have 10 minutes to talk to a family, if that.
Right, if that.
If that.
So let's talk a little bit about the process. And you can keep this as simple, as non-scientific as you want, but you show up.
Yes.
And then
I knock on the door. I never ring the doorbell.
As you should not for dog owners, because why get them involved?
I never ring the door. So I actually have my assistant call when I'm headed their way. And then they can sort of mentally prepare.
Yeah.
Some families will just leave the door slightly ajar. Some people will just leave it unlocked and say, come on in.
Right.
I enter the home as quietly as possible. And I always put my bag down and my stethoscope down so there's no scary smells. I always hug. I'm like, I hugged you.
You did.
I'm like such a hugger. And then I sit. And now this is where it's different for everybody. Some patients are reactive. They don't want to be touched. They don't want to, and I don't do any sort of, you know, I don't check anybody's temperature, and there's no thermometer going in the butt. Like, I'm very minimal. And so I sit with the family and I spend as much or as little time as they need. And what I mean by that is I've had some families say, Doc, we need you to come, we need you to help, and we need you to leave. And I'm totally fine with that and respectful of that. I have families that need a lot more time. They need a lot more guidance of, like, are we doing the right thing?
Right.
Are we doing what they're ready for? So I sit with the family and I let the patient just kind of get comfortable with me, or I don't get near the patient. I had a patient yesterday that was very reactive and he didn't want to be touched.
Right.
You know? So, but medically speaking, I always give sedation and pain medicine before I do anything else.
Okay.
And so I use the tiniest little needles. I'm very discreet. I try to work in the back as much as I can. I don't shave fur or try to find a vein. Again, I have to always harp on this. I'm a very less is more kind of vet. I try to intervene as little as possible. I try to be respectful of the family's space. I'm very minimal. So the sedation helps tremendously because they just start to relax. My patients will immediately just kind of ease into a good rest. And then synergistically with the pain medication I use, they will then hopefully go into almost like an anesthetic plane of sleep. So it's not just like they're laying there and can't move or can't, you know, they are relaxed to the point where they're snoring most of the time. And then once they're at that level of relaxation or sleep or anesthesia, if you will, then I'll shave some fur and place a little, I say IV catheter. It's not one of those indwelling catheters with tape and the whole thing. It's a very, very small, what we call butterfly catheter. And I place it. I actually never ask a family if they're ready because...
Oh, really?
Yeah, I never
Because they're
do.
probably going to back out.
Well, I don't know if they back out. Nobody's ever ready.
Well, yeah, you're not ready, and then that kind of ups the anxiety in the room. It's like, oh my gosh, wait, it's going to happen now.
Yeah. So I always tell families, I mean, and that's just maybe I'm different, but I never ask a family if they're ready because over the years I've asked and nobody's ever ready. Nobody ever says, yes, go ahead.
Yeah.
You know, so I will simply tell families I'm going to get the catheter started and, you know, you stay with your baby if you choose and I will start to administer the medicine really slowly and it can happen very quickly. So the medication itself, it's truly just an overdose of anesthesia. There's no pain. They are rendered unconscious before they even start to transition.
Right.
But the whole process itself can be sometimes seconds. So
yeah. Mine in 2017 was actual seconds.
Yeah, actual seconds.
I'm not even sure we got beyond the initial sedation and pain medication, if I remember correctly.
Yeah,
that was kind of it.
Yeah.
So, so normally could take seconds, could take minutes.
Mm-hmm.
Does it ever take longer than like 5 minutes?
Sometimes if a patient is really compensated, like very low blood pressure or poor venous access, like you can't get a catheter, there are alternative methods to deliver the medication. It could be in a large vessel within the abdomen. It could be in a large vessel on the side of the chest. So there are variable ways. You can even actually ingest the medication. But for me and most veterinarians, it is given intravenously. And that's where you hear like, oh my gosh, it was so fast. So that's, I think, the biggest part I prepare families for is this will work very fast.
Right.
If I need to move or change positions or find a different spot for the catheter, I'll let you know. But I always try to work in the back so the family can, love on them and stay up near their head. And then I never ask if they're ready, but I always let them know, okay, the catheter's in. I will start very slowly.
Yeah.
And so that's, I think for me too, like it just takes the pressure off of them making, again, another difficult decision of like, okay, we had to make the decision to do this. And now we're making the decision to call the vet. And now we have to make the decision for her to give the medicine. So I try to take as much of that grief and difficult decisions away and put that on myself.
Yeah.
And then just let them be mom and dad. Let them be the pet owners.
Yeah. I think that's great. I think that's what most pet owners need, especially at that time.
Yeah.
So if people in Jacksonville wanted to find you, what's the best way to get in contact with you?
So I have a website. It's www.drkatiehospicevet.com. And then you can call my cell. It's 904-521-3440. And we are very hands-on. I mean, when I say we, it's just my assistant and I. You can call or text anytime. A lot of people text too, and that's totally fine.
Right.
Because it's really hard to, I think it's very hard to make the initial phone call. We get probably more texts than calls now.
Yeah. Kind of on that note, I did not make my call. I had a vet call for me, and then I had someone else call to cancel it.
Yeah.
And then I had one of my employees at the time call and do it. And then I had her call back and cancel it. Yeah. And then I cannot remember who made the final call. It was someone I worked with. It was like a part-timer I had that I was managing. And I'm like, can you make this call for me really quick? You can leave early today. And she's like, okay.
Oh, I know. It is such a hard phone call to make.
Couldn't do it.
So a lot of people text, and that's absolutely fine. And we will text right back.
Yeah. Well, thank you for being on the show today and educating everyone. And,
You're welcome.
Thank you for the work that you do.
Oh, thanks for having me. Part 2.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.